He's so cool. Oh gosh, yes. So let's start the conversation. All right, we'll wait. Let's wait like a minute, I think, for people to like kind of see what I. And did you get to see Aftershock? Well, so I can't even tell doing it this way who's on, but I know we live. I could probably tell from here. Yeah. So we'll just start off by talking about why we're here today. So it was always a brainchild of Nikki, right, Miss Nicole, to do a Barbershop Convo Series, which was just an opportunity to have a space in the community that would allow us to just talk about and have discussions, right? Isn't the barbershop the place where you have those discussions, right? It's where you come and like meet as a community and just discuss things as a community. So this Barbershop Convo Series idea and is now like it's now an opportunity for us to have a space. So we want to thank Nicole for just coming up with that idea and just giving just people like myself, people like Miss Amina, who I'm gonna let introduce herself, but just giving us spaces where normally there are none to just talk about the really heavy topics that are not normally addressed. So this particular Barbershop Convo Series is on perinatal and maternal loss, and the title of it was Let's Talk Perinatal and Maternal Loss, because I just feel like in our community we're not talking. It's not enough talk, and it's not enough talk that's evidence-based and solution-based, right? Because there is a solution to all these issues, but we got to start having a conversation to start developing what those what the ways or what it is that we can do to shine light and make a difference. And I believe that when we look at black women dying at birth 3 times more than any other race, black babies dying 3 times more than any other race, and me as a black woman, how can I not just even see that this is something that needs to be addressed? So I'll introduce myself first. Sharon Turnage. I am a licensed social worker, a licensed addiction counselor. I'm the founder of the Tyler Nicole Foundation, who was organized to provide support, education, and awareness to the plight of perinatal infant loss and childhood life-threatening illnesses. I'm also the founder of the Danvers Leukemia Fund that does awareness to blood cancer. The blood cancers, especially when it comes to leukemia, which is what my son had when he was 4 and who is in remission by the grace of God, and has been pivotal in shining a light in communities all across this country on blood cancer awareness and building a bone marrow registry. So I've been blessed to just be able to do all of this in the name of just building, I think capacity building, right, is what we would kind of call it, and community capacity building. And so I want to introduce this amazing person right here, Amina, and I'm going to let her introduce herself because I think she can do a better job. But one thing I do want to say is that it's so refreshing, right, to be able to be in spaces with other black women and men, but black women, that are invested in really bringing about change. And so this is who she is to me. So I'll let you go, Amina. And yeah.
Sure. So my name is Amina Woods. I wear a couple of hats. I'm here today in the capacity as a birth doula. So I'm also a licensed social worker, practice as a clinician, and for over 15 years I've worked with New York City's most vulnerable populations. So that's children, their mothers, their families. And so most recently, I decided to lean in more into the maternal health, perinatal field of work, mostly because of stories that I've heard from the women that I've worked with as a private practice clinician, stories that I've heard from family members, from friends about their experiences, and then learning more. The more I learned in my training as a doula, started realizing that how some of my rights as a patient, how those rights were violated. And so I'm here today to talk about the type of support that doulas can offer during that perinatal period. And so when we think about perinatal, right, that perinatal period is that time between pregnancy, labor and delivery, and that postpartum period as well. So those are very vulnerable periods where women are at higher risk of things going not so bad, right? We're at higher risks of anxiety, higher risk of
pregnancies, preeclampsia, and just different issues, which isn't necessarily biological, right? Because when we think of somebody, so we'll start here, right? When we think babies, we think birth, right? We think normal birth processes. We think somebody finds out they're pregnant and 9 months later, here is this baby, right? We don't tend to connect birthing with high risk issues, with loss, with NICU, right? Which I'm gonna let you dive into that more because that's your area. We don't tend to think that IVF issues. We don't tend to think people not even being able to conceive, so not even having that option to experience having a child, having a birth, going through pregnancy. And so, one, we need to know that there are issues, right, in having babies, right? This is not it's not that rainbow, that light at the end of the tunnel, right? It is problematic for so many. And so I wanted you, as a doula, to first touch on the fact of what can be some of the things that occur when people are just pregnant, and what are some of the trials and tribulations that people can experience.
Yeah, it can. So we were having a conversation just before we went live, and I was sharing with some of the ladies here about our medical system here, right? And if you know the history of the American Medical Association, you would know that the system is designed exactly the way it functions, right? The system is designed in a way to where there's not a human approach, a humanistic, a holistic approach. The bodies are used and disposed of and it's been that way since the inception of the Medical Association, right? Bodies have been disrespected and disregarded and dismissed simply in the name of advancing medical research. But I'm so glad that nowadays that there's such a spotlight that's being put on this particular disparity. I would say that I think that one of the few but necessary good things that came out of COVID, I think, has been this spotlight, this illumination of all of the disparities that so many of us, we already knew was a part of our communities, right? We may not have necessarily had this language as a disparity, that it's maternal mortality, but we knew that there was this underlying energy, this current within our communities that, you know, there's a chance that our mothers won't make it out of the delivery room. That's an underlying current that we live through. So I'm happy that City of New York is having the citywide doula initiative that started right out of a pilot program from Healthy Starts in Brooklyn, and since COVID, they've taken that pilot program and they've expanded it to all 5 boroughs, to where now if you're Medicaid eligible and if you live in certain catchment areas across New York City, certain parts of Queens being one of the many neighborhoods, you'll qualify for doula services. And so what doulas, right, there's actual research that shows that, you know, while doulas, we cannot prevent, right, while we don't prevent some of the fatalities that happen during childbirth, while we don't 100%, while we can't prevent the mortality of moms and babies, there is research that shows that with the doula present, it can significantly reduce those risks from happening. So I gave you an example of a client who I have now who's due in January. She was being seen at a hospital in Manhattan, and she was a part of their clinic. And so there's so many red flags that were coming up, right? She's at the clinic, but every time she goes for an appointment, she's seeing a different provider, right? So that's red flag number 1, right? Because pregnancy should be a very intimate, right? Very personal experience. But if you're seeing a different person who's giving you different information every time you visit, that takes away from that personalized, intimate experience. So then that was red flag number 1. Second red flag was the way they presented information to her was very in a very heightened sort of histrionic type of style, right? That made her very anxious. She's already someone who had a history of excessive anxiety. So now she's hearing and reading through her online chart, through her My Chart, that has this jargon that's freaking her out, and she's not getting answers from the doctors. There's a disconnect between explaining to this mother what's happening, what are the risks, right, what are her options. There was a disconnect between what she needed to know to help alleviate her anxiety versus how they were able to articulate their concerns. So long story short, because of the resources that I had as her doula, the advocacy that we were able to do together at one of her doctor's appointment, we got her changed to a different doctor, mostly because this doctor, or one of the doctors, or their approach at this clinic was to take the high intervention, right? The high level intervention where they automatically wanted to go in and do this medical procedure, where there were risks with the medical procedure too. Her body wasn't showing that it was rejecting the baby. Her body wasn't going into preterm labor, but they were rushing her into this medical procedure, and she just wasn't sure why. And so my role as her doula was to help her. What I realized what she needed from me was to help her stand firm in what her gut and what her body, what her spirit was telling her. She felt that it was totally unnecessary, and these are the words that she was telling me. She said, I felt like it's totally necessary. I feel like I'm being a guinea pig right now. I feel like they're just looking to make money from me, right? And she asked me, am I being too stern? Am I being too sort of like forceful? And she was really unsure. And so my role there was, one, to help her just get some clarifying questions from her provider, just to ask all these questions, right? Like, is this medically necessary? Is her body rejecting the baby? What are the risks? What are the pros and the cons? And then just to also help her just be confident in the fact that she didn't feel comfortable She wanted a second opinion. And so with the help of myself and some midwives in my network, we were able to connect her to a specialist who then helped her get to a high-risk specialist, right? And now she's on bed rest, where with the previous provider, they didn't even recommend bed rest. They told us, and I asked, they told us that bed rest wasn't even necessary, right? They just wanted to go in and do the medical procedure, and there wasn't even a chance that that procedure would resolve whatever the issue was with her anatomy, right? So I'm so happy to know that she's in better hands. But right, if we can almost conceptualize what things would look like on the day of birth, right? Because if it started with an unnecessary medical intervention during pregnancy, guess what? Chances are they would have recommended an unnecessary C-section down the road as well, right? And so in the unnecessary C-sections, those are the procedures that create the environment for a distressed baby, for a distressed mom, and that's where we have a lot of our losses as well.
So I'm jotting down my notes. So what you were describing is to piggyback off of what you said. So the first thing you described was inconsistent care. So what inconsistent care is, seeing different doctors, communication not being between those doctors, and so you can't get high quality care, right? So that was one thing you talked about. The next thing was this communication barrier, right? Because if the language isn't understandable, then how do I understand my treatment, right? So that communication barrier is very, very, very toxic in a sense, because if I can't, I'm not going to understand. And then the doctors already have that godlike mentality. So they're already thinking like, I know what's good for you. Doesn't worry, I'm going to do. And then you can't be apart because of the language. You don't even get the language. Then another thing I wanted to point out was the doula initiative. So I don't know if people even realize the reason why New York and Brooklyn started the doula initiative, because New York City, and where is the other place they launched it upstate? So they launched it in one place upstate, one county, and in New York City, because they have the highest perinatal rates. That's why they didn't launch it in anywhere else. And if you notice, they launched it in all 5 boroughs, because the numbers in New York are high. The perinatal mortality rate is high in all 5 boroughs. So we're looking at it as, wow, they launched this initiative, but they launched it because we have a problem where we are.
Absolutely.
And so it's important to understand, and so then it goes to us watching Aftershock and Toxic. So the homework was to definitely watch Aftershock, and then if you had came, you would have watched Toxic. But both, so just to give a little background, if anybody out there didn't see Aftershock, Aftershock highlights maternal mortality. It talks about maternal loss, and it follows 2 fathers, 2 husbands, I believe they both were husbands, that lost their partners after childbirth. And the point of Aftershock was not just to give that lived experience, right? Which was so amazing in that movie, but it was also important to see, to shine light, that women are dying. Black women are dying, right? And that, like you brought out earlier, the system is working.
Yeah, by design.
It's working. So Black women are dying, and this is how the system is. And why Black women are dying more than any other race. It's not even like Black women are dying more than white, but Hispanic numbers are the same. No, right? Hispanic and Asian numbers are level, and Black numbers are 2 to 3 times more likely, depending on where you live.
Yeah.
So I don't know if you want to elaborate on
That's a loaded question, right? Why are Black women dying at a higher rate? And I mean, long story short, it's systemic racism, right? That's the long story short, because all of the issues that come up that cause the maternal mortality rates and the infant loss rates are all preventable. They're all preventable issues. We watched in Aftershock, right?
Yes.
Was it Aftershock where one of the
the mother that we were just talking about.
right.
Could you go into not Shamani, the other one, the one that they
Amber?
didn't read,
right, where her levels were,
or maybe
her platelet levels were gradually getting lower, but it was basic neglect from her medical provider. They didn't catch that her platelet levels were lowered every time she went to the doctor, and then when she did start to complain about having shortness of breath, they were dismissing her, right? Oh, it's normal. Oh, just make sure you go and get some rest. So her voice wasn't being heard. And when we think about the history of the experiences of Black and brown people, just in many of these systems, right? Not just the healthcare system, the healthcare system, the education system, the criminal justice system, right? It's a running theme, a pattern where voices aren't being heard, people are being dismissed. I mean, once upon a time, in some of our medical manuals of AMA or let's not even talk about the Psychiatric Association, right? The Psychological Association, but all of these studies that were done on the bodies of Black women, enslaved women, were then used to create these stereotypical narratives about how we are physically, right? We can endure more pain. So back in those days, medical experiments were done with no anesthesia, right? So our calls for relief from that pain historically has always gone unheard because we haven't always been the recipients of that comfort and care anyway in the medical association. Still.
Because when I had my first daughter, I wasn't 26 hours of labor. I wasn't even given an epidural. I wasn't even offered it. And the cord was wrapped around her neck. So the length of time that I was in labor should have let them know that maybe they needed to check something. When she came out, the cord was wrapped. They cut the cord, pushed her back in, and then cut me to get her out. They basically mutilated, which is I've never even talked about, mutilated my cervix. And so every pregnancy post my first daughter, I had to be stitched and on 9 months of bed rest. And to be open about my loss situation, I lost a set of quadruplets. So I'm coming off, which is why I'm going to connect it. I'm coming off of you mutilating me, not telling me you mutilated me. It was never told to me what had happened. It was told to me that we did what we needed to save your baby. But it was never told to me what was done. So my next pregnancy, I get pregnant with a set of quadruplets. 4 boys, natural, no fertility. But I have a mutilated cervix. So that pregnancy was how I found out about what the doctors had originally done. And I had to be on bed rest, stitched, and even then they weren't able to save them. And I lost my babies, right? Had I not had an incompetent cervix, the results would have probably been different. And at that time I wasn't even able to make the connection because I had my first daughter at 22, the boys at like 24. So I'm not sitting there like getting what's going on. And so I lose the boys because, of course, having 4 boys with an incompetent cervix just could not hold them, even with the stitch. So, had 2 more kids. The doctor. Now, from losing the boys, they told me you need to be stitched every pregnancy and on bed rest.
The cerclage.
The cerclage. Yeah, thank you. The cerclage. Pregnancy, had 2 kids. Next pregnancy, they tell me, oh, you look great. You don't need a stitch. You good. You don't need bed rest. And I'm like, oh, I don't need a stitch. I don't need bed rest, so I don't have to go broke. And I have no money because I'm not going to get money while I'm on leave on bed rest.
Yeah.
And so you're telling me I could make it. I could still pay my bills. I could still pay my rent. Oh, fine. No stitch. No cerclage, right? What happens? I open up at 6.5 months. My water starts leaking out. And then the next thing you know, I lose that baby, right? Don't think the doctor meant to do it, but I think the doctor didn't even look at my history and utilize that as a bar,
right,
to say, you had that loss, even if we're not sure, stitch, stitch, stitch. Of course, once I lost Tyler, they told me every pregnancy now on, you'll be stitched, but by then it's too late. So.
And that doctor who told you you didn't need to be stitched, was he a specialist or anything like that, right?
No,
so it just reminds me of how important a doula could have played in that experience, right? Just in so many different things, right? So the doula could have helped second guess the recommendation made by that doctor, particularly because of your history, right? And so the doula will be there to help advocate for those types of things. And then whatever they were doing in your labor and delivery to mutilate your cervix, as a doula, these are things that we are there to catch onto, right? I remember not even until after I had my son years later, I realized the episiotomy, right? The episiotomy that I had, that I didn't even realize that they should have received my consent to go in and to cut me and to sew me up, right? Yeah. But had I had a doula, the doula could have said, what are you doing there, right? Yeah. Because when you're laying and giving birth, you're in the state where you're literally not in your right frame of mind. So your doctor shouldn't be doing anything. They shouldn't even be getting your consent. All consent should be signed before you go into labor and delivery. But having that doula there can help make sure that decisions aren't being made for your body without your awareness, and they shouldn't be asking for your consent when you're literally out of your mind and out of your body as well.
I told you, 26 hours, no pain medication. You're telling me you're going to get the baby out. You don't even, it was sort of a thing to whereas he must have sort of caught. He didn't say to me, he just literally told my sister and her husband, y'all got to get out. Closed the door and just did whatever he did. He never said anything to me. I didn't know what was going on. I didn't even know anything was wrong because I don't know that's my first birth. I don't know that was not how births go. I just thought it was time and they can't be in there.
Yeah.
I didn't realize that it took 10 minutes for my daughter to cry. She didn't cry for 10 minutes. And then not even realizing that was a sign that they were working on her. They never even told me that. These are things that now that I do the work, that now that I could look back, and I'm like, wait, she didn't cry for 10 minutes. I remember my sister saying we didn't think she was going to make it, but I'm saying to myself, why would you think that? Not realizing they're out there, they're seeing what's going on. I'm not. I mean, incompetence, and I don't know if to even say that people did it deliberate, right? Because now in my mind, you butchered me on purpose. And so who's to blame?
Right, and that's where it gets really tricky and scary because we think about like implicit biases that are a part of the system that makes the systemic racism a thing, right? Because many of our medical providers, they come from backgrounds where they innately bring these biases about certain types of people into their work, and so their approach to the population, to the patient population, is basically a byproduct of some of these implicit biases. That's why it's really important that we have representation in our medical profession, right? We have doctors, nurses who look like us, who come from the communities that we come from, who are aware and who have firsthand knowledge, you know, who've heard these stories in our barbershops, in our hair salons, and so that they can give the, you know, justice to the women who look like us. They can come in and listen to their voices and not have them feel dismissed or unseen.
Can I piggyback off of that? Because you said we need to have people that look like us. So we need to stop being a community of people that are trying to advocate and say, hey, I can make money on social media. I don't need to do this. I can make money. I can make millions. I can do all of that, right? In India, I believe it's India, is they literally, from birth, start scouting out their youth. And they literally say, we need a certain number of doctors, we need a certain number of lawyers, we need a certain number of engineers, we need this. These kids are good at math, they need to go into engineering. These kids are good in science, they need to be a doctor. These kids are analytical, they need to be a lawyer. They make sure that a certain population of their youth that are coming up are going to be pushed into these fields. Why? To ensure that they have providers to service their people, right? We aren't actively telling people in the community, you can be a doctor, you can be a lawyer, you can be this. As a matter of fact, we need you to be a doctor. We need you to be a lawyer. As a matter of fact, when I told some people I was doing my PhD, I got responses, so overwhelmingly, everybody was supportive and very proud of me. And I'm happy with my Queens community. You guys pulled out the red carpet for me. But I did have people that said to me, more school? Why would you do that? Like, why would you, what's wrong with you? Like, I'm going to make money. I ain't got time for school. But you know what? I can't impact change in the system without having my PhD, right? Because now then with my PhD, I can do the research, so my research can impact the system, right? Because all of what we're talking about is micro, individual, right? But you can't make a difference on an individual level if the system is broken, right? So me becoming a doctor, a researcher, was so I can impact it on that macro institutional level and let that then trickle down to the community and then trickle down into the individual services that you guys will then receive.
Absolutely. I'm all for it, right? Because it's all about affecting policy. The research will inform the policy. The policy shapes people's behaviors, right? We're human. We're flawed, and sometimes we need some guidance and some instruction on how to behave, you know? And so policy is what got us into this mess. We need policy change to help get us out of and clean up and recover from the disparities.
And I want to add to that. So I've heard many people say, I ain't voting for these people because they ain't doing nothing for me, because they ain't doing nothing for me. And I ain't voting for them because I ain't going to vote, right? The elected officials are the ones that create the policy.
Yep.
So it's not just reproductive health, criminal justice, schools, everything. Your elected officials are only there, right? Their job. And that's where we need the education to go back to the branches and the systems of government, right? So the elected officials, they're the ones that put the policies in place. I'm going to say it as simple as possible. So if you put an elected official in there that does not care about you or is invested in you as an individual, the policies will not reflect you. And the policies will reflect what they want them to reflect. And so why nothing is working for black people is because a lot of policies are racist.
Yeah.
And they're not for us. And Sheena, I seen you in there, so I wanted to talk about. That's some good. So, Sheena, you've been, first of all, Sheena's like my sister. We've been down with another. We've been in a space with another systemic issue when it comes to blood cancer. Not to shift, but when Sheena knows me from when my son was diagnosed with cancer, and the hospital system, and I ain't gonna make it easy on them. I'm gonna keep it 100. Was not supporting me as a black woman. I've never said that. What I did was, it wasn't supporting me, so I started a nonprofit. But I started the nonprofit because it wasn't supporting me. And so there's another area where I'm lacking that support. So we have to get proactive, right? In the best way we can. We have credentials that we can be more hands-on, proactive, even individualistic in nature, and even on policy, right? But you guys out there could get active, because all you have to do is tell somebody to watch this video over once we post it, or some of the information we give you here, share it with other people. That's how this trickles and snowballs into us figuring out how we can really do this the right way. So I don't know if you want to, because Sheena had brought up, and you the doula, so.
There was a question about doulas.
So she said, get an interpreter. Sheena, we're going to answer some of them things. So you said it's hard to get interpreter in the hospitals. Do you?
Well, you have a right to an interpreter at the hospital. If you're working with the doula, definitely the doula can support you in getting access. And then there's some hospitals that have built-in doulas as well, which is great, although you only meet that doula the day of, right, the day that you're giving birth. So there's some problems with that. So as far as language support, you have a right to an interpreter. I'm not sure why sometimes it's difficult. It is. It does prove to be difficult at times, possibly because of resources, but you do have a right to an interpreter when you're at the hospital.
And then the 100, see what she said, I'd be thinking.
So about money, right? I think we have a lot of I think we have enough stories now to realize that when it comes to the systemic racism in our healthcare system, that it doesn't matter how much money you made, right? It doesn't matter the money that you make, because we have Serena Williams' story. She's a millionaire, right? Probably rated as the best athlete in the world, and her story goes that she wasn't being heard. She had to make her healthcare provider listen to her when she knew that she was experiencing a blood clot shortly after the birth of her first baby.
And money may help when you are white, right? But money is not helping when you're black. And that's this whole, then we go to the socio-ecological, which is hard for me to kind of talk about that, because that's a whole system and a framework. But to sum it up in a nutshell, our systems, right? All these different levels. So the individual level, the community level, the macro level, which is the institutions, and then the policies, right? All of those things together kind of intersect to create the situation that we have with black women, dying and black babies dying. It's that whole intersect. And I'm going to take some time, and maybe, Amina, you'll do this with me more, because, like, there's so many things that we need to dissect. And I'm tired of sitting in rooms at conferences with people that are educated, right? Because they already know this. I want to bring this to the community that doesn't have this information, to understand how intersectionality, and just a real quick thing.
Yeah, I think so. So Toxic showed that pretty well, right? Where I think it was through the course of just one day, you got to see all the multi layers of stress that she was dealing with. So she went from she's raising her son, right? So she's raising a teenage son, but then also dealing with the education system and all of the stuff that she's dealing with her son and him, right? There was an argument over his locks being on the wrestling team. Also body image, she's dealing with her body image, her changing body, but also the stuff that we deal with as black women when we're not pregnant, right? What are we doing with our hair? What's our skin looking like? What's our weight looking like these days when we're not pregnant? Then there was the stuff on the radio that she's listening to, so she's
of the black kids
exposed to stuff around police brutality. So there's that anxiety. So it's anxiety on top of anxiety, which essentially just breeds a hostile living environment for the baby inside of you.
And I was also stressed, especially when Tyler died. I was coming out of a bad relationship, being stressed out about it. Taking a train, never given a seat. Once again, not being stitched, not being put on bed rest. Couldn't put myself on bed rest. So having to stand on a train sometime for an hour with an incompetent cervix. I can only imagine now in hindsight. My results were going to be that, right? It was a recipe for disaster. So just being a black woman in America, in a sense, the most disrespected, right? I keep saying it. Also not protected, right? Black women are not protected. And I see some more good points, which I'm getting to you, Dominique. Thank you. My classmate, Dominique, I miss you. But I so appreciate it because she works in a hospital setting. And she wrote, by law, you're entitled to an interpreter. You can file a grievance with the hospital if that happens. Thank you. And if there's anybody out there that can add to this, if anybody has questions, write it in the chat. And
yeah, absolutely, because that's one of the questions that come up that I hear is because our advice is to speak up and to advocate. But one question that comes up is how, right? How do I get my voice heard? If I'm in pain or if I'm doubting some information, how, right? And some of the ways that you can get your voice heard, Dominique mentioned, you can file a grievance with the hospital if that happens. But, right, like if you're in the middle of, say, your delivery and you're feeling that there's some things going wrong, or maybe you're not in delivery, maybe it's weeks before your delivery, I would suggest keep complaining, right? So you speak to the charge nurse, right? The charge nurse is on shift. He or she supervises the rest of the nurses on the floor. And you can continue to take your complaint up the chain of command. Make sure that you request or you demand that the doctor write your concerns in your chart, right? Because if it's written in your chart and something happens, then the doctor and the hospital, they have to take accountability for that, right? Because there was a concern that you mentioned that sort of went unheard. And from what I've heard is once you ask the doctor to write it in their chart, usually that's when they come around and start to kind of give
on
thought
paper
to what you're requesting or what your request is.
And that's just not with reproductive health. Once you put it on paper, like with the police brutality, if we start putting on paper everything that's happening and not just going, oh, they stopped me again, brush it off. No. after a while, something will have to be done because it's on paper. It's evidence proof. We could file a class action suit or anything, but you can't do anything without proof. Another thing is, Sheena was talking about the C-section, and I was told that Black women have the highest rates of C-section, astronomically high, and not necessary. Could you elaborate on that? And then I'm going to get to Jennifer's statement.
Yeah, because the crazy thing about the medical system, right? And I realized this when I started practicing as a therapist. The unfortunate thing is chances are it's really the insurance companies that are dictating the type of care. So with C-sections, hospitals are reimbursed at a higher rate for C-sections. I'm also told that it costs, compared to vaginal delivery, right? The cost of the C-section might be a little lower than the cost of a vaginal delivery, but the hospital they receive more money for the C-section, right? So when you think about things like that, it kind of almost makes sense why there's this rush to the C-section, essentially. And like I said, while I'd like to believe that many of our medical providers are definitely well-intentioned, not being as thoughtful, not being as patient-centered in that care, just taking a cookie-cutter approach based on an algorithm of the electronic health system, right? When you're providing care in that way, then you're heading down the path to unnecessary C-sections, definitely.
And then Jennifer's comment, I say, hey Jennifer. So she said when she was in premature labor, the doctor told her to have an abortion because the baby wasn't going to make it. But a lot of those decisions are just rushed. Like, okay, I got about 5 minutes. Okay, I wouldn't keep the baby. It's not gonna work. Like, I'm on to the next patient, right? And maybe you could, I'm not so privy on, but from what I'm hearing, you might have a doctor that's seeing how many patients, may only have 10 to 15 minutes with a patient. So you're going to just make a rush without having all the information, without having that personal, I'm making that personal relationship with you. You're just a number. I want to make my money for the day. So I'm going to see you, fit you all in. I'm just going to give you all a bunch of medical.
Yeah, that reminds me of the story that I shared just earlier in our conversation, right? And the role of the doula can help slow that provider down, right? Because like you said, many times they are rushing to get to the next patient, but giving them the opportunity to slow down just a bit, to explain more, right? Because this is information that the birthing person and the families need so that they can make an informed decision. Informed means telling you all about the risk. What are the pros and the cons? What will happen if I do this? What happens if I don't, right? And what is it that my body is doing right now that's telling you that we need to have this emergency procedure, that we might need to abort the pregnancy, right? And by giving you a wraparound of information can help the birthing person make a more informed decision for themselves. And I really feel terrible, Jennifer, that this is the information that your doctor gave you. And so I also practice as a psychotherapy, and my favorite part about how my work as a psychotherapist and a doula intersects is being able to help the birthing person tap into their own innate power, right? So like when they tell us our bodies, we have everything that we need to do the work of giving birth, right? And just to do anything that we need to do as on a human level. But on a very human level, we have everything that we need, including our instincts, including our gut, whatever you want to call it. If you want to call it spirit, you want to call it God, you want to call it your gut, you want to call it your voice. We all have this internal compass, right, that tell us what we need to do for ourselves. And so I'm really happy, Jennifer, that you were able to listen
Oh.
to that voice in you to let you know that you will be okay. And 31 years later, your daughter is still here, where the doctor was telling you to, to abort the pregnancy. So good job for you for listening to yourself. And I said this before. Now, for those who are thinking about getting pregnant, the best thing that you can do, one of the best things that you can do to prepare, is learning how to listen to your voice, learning how to listen to yourself, because that's the one thing that you'll have that will work in your favor. That's the one thing that you have, your gut, your instinct, because when it's you and the doctor and you need to advocate for yourself, sometimes your best advocate is yourself. But the only way you'll be able to do that is if you're able to listen to what you need.
And I was getting ready to say, tap onto that, because at the East Meadow event, you talked so much about how you know what is best for you. Yeah,
you are the expert for yourself, right? The doctors, they have whatever education, whatever knowledge. Knowledge is limited, by the way. You have the education and the knowledge to help assist you get through your journey of birth and motherhood. However, you've been living with that body for X amount of years, 35 years, 40 years, 50 years. You know what your body is saying to you when it says it. So learn to listen to your body, because you're the expert, and you'll need that information to advocate for yourself as the best expert.
And if they don't listen, like I said at the event, make them listen. You make them listen. They don't want to listen, make them listen. And if they're not listening, then you get somebody above them, go above them, demand it. Dominique put in there patient services.
Yes. Patient relation services, patient services is who you can complain to. You can speak to the charge nurse, right? You can speak to the attending physician on site, right?
And you can ask for social work now.
Social workers, you can ask to speak with the social workers on the unit and take your complaints up the chain of command.
Up the chain, and demand it, right? Because doctors are not gods, right? They're just human people, and they make human decisions, and maybe they'll make the wrong decision with the right intent. Not trying to make it seem like people are just out to get us, right? I think they're people themselves, just trying to take the best course of action. We know ourselves. We just know. And they view us, right? They view us in a different light. So maybe may not understand what works for us. So now we go to cultural competence, right? I think a lot of providers are not culturally competent. So like you said, they can go in with the bias that they don't need pain medication. They enjoy pain just fine. And going back to representation, right? When you think about the rates of medical providers who are black, I think they represent under 4%. 5%.
Right? Under 4%.
4% PhDs, 5% doctors, 5% lawyers.
Yeah. So when you consider where the medical, the disconnect, where the cultural disconnect comes from, is, oftentimes we don't have enough of us in those spaces. So access to education, right, for black and brown doctors is absolutely necessary. For clinicians, for social workers, is absolutely necessary. So we can have those who understand, right, understand what our voice is saying when we're saying it.
And because there's only 5% of providers that are black, right? So you can get a provider that's black. You may not have access to that provider. But then you can get somebody that's of a different race, but then you can ensure that they're culturally competent, right? Because that's what's necessary. That's what's lacking. To me, the discrimination, I think, is the biggest factor. I think, I just think, I don't have that connection. We see it with gun violence. There was a video of a 12-year-old and a 14-year-old shooting at the cops with an AK. And yeah, they were shooting at the cops with an AK. And on the video, y'all need to watch it. The cop said, "I don't want to have to do this. Like, please let them stop." He shows so much empathy, but I don't have to tell you the race of the kids. Yet and still, they ran up on Tamir Rice, and within seconds, shot him down. So what we see going on just out in the world is happening to us when it comes to our reproductive health. I demand reproductive justice. I talk about it everywhere I go. And what reproductive justice is, and I think Sheena had said something about equality, right? Care needs to be equitable, and it's not. And providers are saying it's not. So we're not saying it as people. Yeah. They're Black providers and clinicians that are not receiving equitable care, and they're doctors and nurses and therapists like us. So we need to demand reproductive justice, right? And that needs to be, as a community of people, we need to demand that, right? They say that you can tell how a country is prospering if you look at their perinatal loss rate, right? And the U.S. has the highest perinatal loss rate of any other industrialized nation.
Even doing worse than third world countries, right?
Yeah.
We even have third world countries who are doing way better at caring for their moms and their babies better than us. Yes, so, I think we're like number 2 worst in the world, if not number 1.
And so 1 million babies die every year. 1 million pregnancy infant losses every year. 1 in 4 mothers experience a loss. Black women 3 times more likely to die. Black women 3 times more likely to lose their babies. Black women in New York City, right? We're in Queens right now. New York City has one of the highest perinatal loss rates. And we have supposedly one of the best healthcare systems between Mount Sinai, Columbia Presbyterian, Northwell. I mean, I don't have to really name the hospitals. They all have the bad rates. So,
yeah, speaking of that, so there's an app that people can use, right? So there's an app that you can use. It's called the Earth app.
Yeah,
right?
I did an event with her.
IRTH.
Hopefully she'll come out and we can maybe talk with her.
That'll be cool, right? They say they leave off the B for bias. So it's the Earth app, and it's basically a Yelp. It's the equivalent, so to speak, of like a Yelp but for birth providers. So you can go online and you can check out the reviews of the providers. So at least you know those who need more work, those who you can avoid, but also for those who provided great person-centered, patient-centered care, you can leave reviews for those providers as well. So I would encourage you all to use that app, to share that app, so that we all can be informed.
So Earth. Take off the B for birth, Earth, right? Earth app.
IRTH. That's the Earth app. Because when I think about birth equity, right, I think about like Black Lives Matter, right? And when as we continue this movement for Black lives, we also have to remember that, the push for Black lives, it has to start before birth, right? And so this is why we're here today, to talk about the Black lives who didn't get to make it, the lives that should be here, right, because of preventable and avoidable circumstances, but they're not here. So when we shout Black lives, let's also be sure to include the fight for reproductive justice, the fight for birth equity, and the fight for moms and babies to make it through that journey of birth.
And I'm happy you said that, because Black babies are dying, but Black young men are dying. Right? Black men and women, period, are dying, right? So then we have to look at it as not just the reproductive health system. These systems are designed for us to not make it. They really are. I mean, and then we tend to get issue centered, and what I mean by that is, well, I don't have babies, or I'm not gonna have a baby, so that's not my problem. My issue is this, right? But what we don't realize is, even if we can't connect to an issue, it's our issue if it's our people. And I'm for my people. I'm black and proud all day, and I hit them streets. I don't care if it's gun violence. I don't care if it's education. I am for every topic. Why? Because if one system doesn't work, then none of the systems are going to work. There's such a thing called homeostasis, right? I think we may have learned that in school, but the concept with homeostasis is, you know, all the moving parts are working, then the whole system works, right? But if one part isn't working, right, then that kind of impacts the whole system. And the goal of homeostasis is to always achieve equilibrium, is having all the system and the moving parts working together, right? So if reproductive health equity, right, isn't working for us as black people, then why would we think the criminal justice system is going to work? Because this isn't working for us. So now that's, of course, not working for us, right? Everything isn't, well, that's not my problem. It's all our problems. We need to start, and then as a community, I need for our people, and I'm not saying we're not, but we need to step up, because the problem is we're the ones dying the most. But there are other people that are way more vocal than us. They're vocal. They're even vocal for us. We gotta be vocal, and not saying that we don't want to be. Maybe we don't know how, right? So swing it back to Nikki. I appreciate you for having this Barbershop Convo Series, right? For having a space for people to have discussions like this, because you never know who is going to be helped, right, by this conversation. And so, and yeah, good. Because I know we pulling up on time.
Yes, well, I definitely hope that those who are viewing, there was one takeaway that you got from it.
Oh wait, please. So she's a doula. So now, I always like to do a call to action. That's always my thing. So one call to action is, we have an amazing doula right here. She is in Queens, in the community. You guys can reach out to her for services. Now, I ain't trying to put you on the whole Queensboro, but
well, let me plug the CDI program first, right? Because I don't know if you can see the info.
Yeah,
you catch
down.
the QR code.
Oh, then a little up,
right?
For the QR code, and a little more in. Yeah.
Okay, I hope somebody caught it. However,
yeah,
right? So this is, if you are, you could be eligible for free doula services if you live in New York
Give me
City.
this. I'll make sure the code gets on.
Yep, if you live in New York City, you might be eligible for free doula services. I don't know, it seems like, at least in my network, I might be one of the only, one of the very few Queens-based doulas. But we do need more Queens-based doulas, right? We're here, we're ready. And Queens is such a huge borough, and it's really hard for me to get from Jamaica to Far Rockaway, so we need more doulas. However, I do enjoy doing this work because I do get to help prevent, right? Do my part. As my dad would always say, his voice resonates as, you know, making sure that we are part of the solution, right? Identifying the problem and being a part of the solution. So if you live in New York City, you could be eligible for free services, doula services. You can Google the CDI, Community Doula Initiative. You just need to be Medicaid eligible and live in the TREE network, which is the task on racial inequity. There's a task force that was created out of COVID to address some of the disparities, and maternal mortality is one of them.
Talk about the baby shower thought.
The baby shower, as far as hosting a community baby shower?
No, like when we were talking about gifting.
Oh, yes. So, a great idea, right, for doula support. So while there's the CDI doula that you get, which is a birth doula, and while there's some postpartum visits that happen, we don't provide postpartum doula support. So a great idea is when you're having a baby and you create your registries, allow for some donations to go towards a postpartum doula, or even just a birth doula in the event that you are not eligible for the CDI program, but paying out of pocket is a bit much for some of you, right? You can always add doula support and have a particular, a specific fund to raise for a doula. So you can have a birth doula, you can pay for a postpartum doula. There's also lactation support specialists out there that can help on your journey to breastfeeding. There's also doulas that support with losses too. So doulas can work with you for birth planning. If you're doing in vitro fertilization, you have fertility doulas, you have loss doulas, birth doulas, postpartum doulas, death doulas. There's so many different types of doulas that's out there. So hit me up. My email is aminatwoods@gmail.com. That's AMINA, the letter T, WOODS@gmail.com. And I'll be happy to share more insight with you on how to get you connected with a doula throughout the city.
I'll make sure it's in here, because we want to.
Yep, at gmail.com.
Okay,
There you go.
good. Because we want to be solution based in everything we do. So
Absolutely.
even if y'all can't flood my friend now, because I need her too, but no, but even if she can't do it, because I know we have certain amounts of people we can service
Absolutely.
and provide for.
I can always refer you to someone
That's
who's
the
available.
point, and that's why I want you to reach out to her. Also, she's a licensed clinician, as well as myself. So even if you're going through a pregnancy or just a pregnancy for the first time, what's wrong with not seeking out the help of a therapist to go on that journey? Like, we do therapy for a lot of things. We can do therapy for that.
Absolutely.
Having a baby could be anxiety provoking, stressful, postpartum, depression. We getting ready to talk about that. We're going to come back and talk about that another time.
When you're pregnant, you're at your probably one of the most vulnerable times. And I'm also working on my PMHC certification, right? So that's the Perinatal Mental Health Care, Mental Health Certification. And that's a specific certification for people who are providing therapy and counseling for this particular population. Because it takes a certain level of care, a certain type of care and time and attention for those voices to be heard and recognized.
Yes, and then a call to action, I think, would be that you guys take the information that you got from this live, look at it, tell somebody else to watch it, tell somebody to give them that information. Like, you can literally just tell them you're entitled to doulas, you're entitled to this and that and a third. Black women are dying, this is what's going on, and you can give that information to somebody, and you can tell them to watch the live. I'm just saying, the best thing would be to watch the live, take the information and share it. And to my women that can have babies, to my women that may be pregnant, seek out that quality care. I have a thing that I say, you need care that is high quality, free, barrier free, right? that's respectful, culturally competent. And if they're not going to listen, and I've said it before, but I'll say it again, make them listen. Don't settle. You make them listen to you. Your baby's life and your life will depend on it. And so I know any of y'all out there had anything y'all wanted to say? Any questions? Oh, y'all good? Yeah, this is good.
This is good.
Listen, we're gonna do more stuff.
Yes.
Yeah. Well,
more to come.
I just want you guys to keep posted because as the Tyler Nicole Foundation, and I'll leave you guys with this. I have an initiative called I'm 1 in 4, Perinatal and Maternal Health Initiative, where we're just going to be popping up all over, just giving this reproductive health information and just ensuring that, we're going to, if nothing else, educate people and hopefully improve birth outcomes.
Yeah, absolutely. Good job.
That's it. So, what is the date? Hold on. I want to give y'all a date, and I'm going to leave this on a live. Hold on. It's coming. Y'all been good. And the responses is good. And if anybody has any questions, even once we get off the live, you can still put questions and comments there. And one of us, either me or I'll get in touch with Amina, we can definitely be a source of support. And yeah, we just getting the date. Make a little announcement.
For the next Barbershop series.
Yeah, Convo Series. Yeah. Yeah, mental health related. Just want to support. I think it's so cool. Listen, I am so amped to be able to be in a barbershop because December 9th? Yeah. So December 9th is going to be the next part of her series, and that's on mental health. And we'll explain it more, going into it, mental health aspect, but we'll definitely be looking at grief and loss. And it'll be really good. Hopefully Amina come back in. Yeah,
I'll be here.
But it's definitely gonna be nice, and we're gonna let everybody know like right away, so you guys. But I'm just gonna reiterate it, and once again, it's so super cool for you to just have something that's available. But listen, we all live in a community, but we all on that communal, and we all live in a community, but we're all not vested in ensuring that community's success.
It's got to start somewhere.
Right.
And that's all I'm gonna say. We all in, and we're all in a community trying to come up off our community, not helping our community. And I'm not saying we're all doing it, but we need to. As black people, period. We're black, and nobody's been coming to really save us. Be good. Yeah, nobody's been coming to be good. Nobody's been coming to save us. I mean, I'm just saying. I think we need to do it for ourselves. We need to do it for ourselves. We need to start solving our own problems. We need to maybe kind of look at other people that are doing it. But and there's enough of us at a level, so I'm going to call out all of these people that have made it in our community, right? Got these titles and positions and money and power, right? That came from the same neighborhood, right? And we could then pour back into our community. And you don't have to live here to do that. If you want to move and go somewhere else because you done made it and you're successful, you can do that. That doesn't mean that you can't be vested in where you're from. I'm invested in Jamaica, Queens. Everywhere I go, it doesn't matter what state I'm in. I'm like, first of all, I hail from South Side, Jamaica, Queens. I put that spin on it. I put that spin on it.
Everybody's on you.
Everybody, listen, they gonna know I'm from here. No, they don't. Everybody. Well, a lot of people. But but they gonna know I'm from here. I rep my city. Why? Because I came from here. And if I don't love where I come from, then that's you gotta look at yourself. I know where I come from. I know what that means, and I know that I'm not gonna try to save everybody else when I'm right here. I need to start here. And that's what we need to do. So anybody out there that wants to link up with us,
What's her name?
Teresa Turnage, you know, and also listen, my sister is here, and I'm gonna rep my mama.
Yes.
My mother
The mothers.
was a mother to everybody in this community, and I am the person I am today because of my mom and dad, so I'm going to say their names real quick. Claude and Teresa Turnage. I'm a proud Turnage. I'm thankful that my father and my mom were in the business of philanthropy and understanding to give back to the community. My father did a civilian patrol in Rochdale where they were patrolling Rochdale and nobody told them to do it. They did it. Rochdale got security. My father didn't say, well, Rochdale has security, so Rochdale is good. Let the security do it. My father was like, Rochdale got security, but we're going to patrol on top of what is there, right? That leadership that we need to start, you know, I'm trying to do it in the area that I'm in, but I welcome other people, and you don't even have to have reproductive health, that being your area. But anybody that wants to jump on board for what we're trying to do, right? Jump. And if I can jump onto what somebody else is trying to do, that's what it is. We become a community, and then we thrive as a community.
Absolutely. I agree. That goes back to being the expert, right? Of not just our bodies, but the community members are expert of our community and what we need. So it's only right that we take care of ourselves. Who else knows? That's why I'm doing this work, right? I said that, like, no, who else is going to take care of our folks but somebody like myself? Why would I ensure that our women, our children, our families are in the best hands if it's not from the community itself?
Because you got to remember, every baby that dies, that could have been a president. That could have been a doctor. That could have been an astronaut. That person could have found the cure for cancer. I mean,
Teacher,
listen,
right?
our
Teacher.
kids is limitless, and I did my area because that was my area. I've always wanted to be a doctor. Anybody know me? I wanted to be a medical doctor, right? But I saw the need for the research. I saw even doctors go by research, right? The research is everything. But we need firemen. We need police officers. We don't want those officers shooting our kids, right? But I wonder how much of the force is actually people of color, right? So if we have these systems that are predominantly white, right, then there lies a problem. And so I just encourage anybody, find the area that you fit in, that is your passion and your drive, and go after it. We need our youth, like you said, we need social workers. Now, we're 2 social workers right here, right? But what's the percentage of social workers?
Just as small, right?
I don't
4%
think
under.
I don't think it's a large number of social workers, right? So, but yet and still, our kids are having to talk to a social worker, and those social workers don't understand our kids, right? And then what happens? Our kids are labeled, or they're this, or they're that, or let's get ACS.
And they're fed into that pipeline.
True story. Somebody was telling me that a patient was going like this. She had a weave. She kept going like this. And the nurse said, we're going to call ACS because something's wrong with her. Something's wrong with her. We're getting ACS involved to take her kids because she keeps hitting her head. She must be crazy. And there was a black nurse there, and the black nurse said, no, her weave is itching, and so she's kind of patting it to stop it from itching. The nurse saved her from having an ACS case. But the bigger issue is the cultural competence wasn't there.
Yeah.
She mistook somebody just, trying to get some comfort for their hair to somebody being insane, and now those people involved.
Yeah.
So we need that cultural competence, and we need that in all our areas. So that's what I'm going to leave everybody with.
Yeah, absolutely.
Thank you so much, Amina.
Thank you for having me. Good stuff. Good stuff.
And we'll see you guys next time. And like I said, reach out, especially to Amina. If you know anybody pregnant. Oh, Dominique, I see you in that chat box, but you know I'm about to tap on you next. So I would love for you to be a part of a discussion. So let me know. Dominique is, and so many people are out there, but Dominique is my classmate. We went to Fordham together. So, and she's very knowledgeable with the healthcare system because she works in a hospital. So Dominique, whenever you're ready, I can utilize you. All right? Everybody, thank you so much. Yeah, she said, of course. See? That's what we're doing. We making a whole, we're going to have a whole team.
Yeah.
We have a team of people. We're going to be knocking on doors. They're going to be like 30, 40 deep. But that's what we're going to do. Thank you, Dominique. I'm going to hit you up. You already know. And I'll speak to you guys later.
Bye. I think we're still live over here.
Yeah.